The Alcohol Assertive Outreach Program. What helps it succeed and what is holding it back? Problematic drinking not only can harm a person's mind and body, but it also impacts every part of their life. It can lead to mental health problems, raise the risk for diseases like cancer, cause trouble in relationships, and make it harder to keep a home or a job. And in the worst case, it can even cause death. In the UK, alcohol problems cost the NHS about £3.5 billion each year. In 2022, more than 10,000 people died from causes linked to alcohol. The good news is there are programs to help people who are struggling with alcohol issues, but there are still challenges that can make recovery even harder. Some treatment centers are far away or difficult to get to. Many people don't know all of the services they could use. And sometimes, different healthcare teams don't communicate well, so patients don't always receive the full care they need. And on top of that, money problems, unstable housing, and other life stresses can make people more likely to drink. Many programs don't offer social services to help with these issues or to give people what they need to rebuild their lives. This is where the Alcohol Assertive Outreach Program, or AAOT, comes in. It's a newer type of program that works with other addiction services to help people get better and stay better. AAOT is different because it's more hands-on and personal, and it follows 6 steps. Number 1, staff only work with a smaller number of patients at once, so they can give each person more attention and better care. Number 2, patients get help from many different professionals, like nurses, doctors, and teams that provide support for drug use, mental health, and community needs. Number 3, staff check in with patients at least once a week. Many other programs don't keep in touch this often. Number 4, staff meet with patients one-on-one outside of treatment centers, often in their homes or other community places, so care feels more comfortable and easier to access. Number 5, the program helps with more than just health. Patients can get support with housing, jobs, money, and both their physical and mental well-being. And number 6, care lasts for a year or more, which is much longer than what most services offer. It's important to mention that studies have researched how well AAOT works, and it was shown to be successful in the US and the Netherlands. But even with its success, AAOT isn't widely used in the UK, and there's not much research on how it's put into practice with treatment programs. So researchers, Scholes, and colleagues set out to answer this very question in this 2025 study. They wanted to find out both what helps and what makes it harder for programs to use AAOT and how to build on its strengths to make it even better. To do this, they interviewed AAOT staff and other professionals in Northwest England to better understand what's happening behind the scenes. This was done by separating team members into 2 groups, called S1 and S2. S1 worked with patients who received hospital care for alcohol problems and were involved for a longer time, while S2 worked with patients for a shorter time. From these 2 teams, they interviewed 20 employees, 28 stakeholders, which are higher-level professionals who play a role in the program's success, like policymakers and managers, and 8 people working closely with the team from other addiction services. These interviews were either in person or during video calls, with questions like, how is AAOT better compared to other services? What does AAOT offer that other services do not? And what influences the decision to use or not use AAOT as a service? And they found what mattered most were 3 important things. Number 1, a positive work environment for employees. Number 2, building partnerships and collaboration with other organizations. And number 3, receiving more funding and research. Let's explore what these mean, focusing on the bigger picture. As for positive work environments, teams interviewed said it's important to feel motivated, encouraged to learn, and positive at work. They also said their jobs require strong support, patience, and training to succeed. Providing more support would help staff do their jobs better and offer patients improved care. This means more patients can receive care that meets their needs. As for partnerships, teams interviewed said it's important for AAOT to work closely with other addiction and social services. Strong connections between organizations can lead to more patient referrals, which means more people can receive support. They also valued meeting in person and training together because it improves communication, reduces negative stereotypes about people with alcohol problems, and helps more people learn about AAOT's services. Overall, partnerships and collaborations can increase patient referrals so more people have a better chance to recover. And lastly, teams said that increasing research is very important. However, AAOT members may not always have the skills or resources to do detailed research. Doing more research could help bring in more funding, which would keep the program running for a long time and make sure patients continue to receive high-quality care. It's also worth mentioning that the researchers had personal experiences with AAOT, had worked in addiction services, and/or were in recovery from substance use themselves. This gave them a better understanding of the results. Now, this study had important strengths. It looked at an area that hasn't been studied much and gave new insights into how AAOT is actually used, especially from the views and perspectives of employees, professionals, stakeholders, and external organizations. Research like this can increase the use of AAOT, help the program to work better, and ultimately improve patients' lives. But it is important to note that the teams interviewed were all based in Northwest England, so the results may reflect this specific area. Interviews can also be influenced by personal opinions or hidden preferences. For example, the way researchers chose stakeholders and how they answered could have affected the results, especially if they gave answers that made themselves or their work look better. Finally, this study only looked at the views of employees, stakeholders, and external organizations, not patients. Future research should include people receiving treatment and compare their answers. Overall, AAOT is proven to be a very successful program, but if teams receive more support, work closely with one another and other services, and increase research to help them receive funding, they could make an even bigger difference.